Thank you, everybody, for joining us today for the June 12th, 2020 coronavirus update for Indian River. Today, you'll hear from Jason Brown, County Administrator, and Miranda Hawker, the Health Department Administrator. If you have any questions, if you could come over to this podium here so the mic is able to pick you up. This one right here, the mic's on for that. So once we take questions at the end, that's if you could just come over there to ask your questions. And now, Jason.
All right, thank you, Brian. Hope everybody can understand me with the mask on. And you'll see something that's different. I have the mask on today. Well, I haven't been wearing the mask in these briefings in the past because there aren't that many of us in here and we're able to socially distance, but I want to talk a little bit more about masks today. As we've opened things up in the community, one of the things that I think I have noticed and I've seen various news accounts about is that the social distancing and the mask wearing the compliance seems to have slipped. Now I want to be clear, as Indian River County, we're not requiring anyone to wear masks anywhere, whether going out in public or at a county facility. And I don't think that's the right way to approach it, but we need to encourage mask wearing in the public when people can't socially distance. So I brought my 6-foot stick along with me again. You may remember this from a couple weeks ago where I showed what 6 feet away is. So if you're not able to maintain that social distancing and stay 6 feet apart and do all those good social distancing activities, then you should be wearing the mask. So whereas I haven't been wearing the mask in these briefings, when I go out in public, if I'm not able to maintain that social distancing, I'm wearing the mask. It seems, unfortunately, lately, to mask or not to mask seems to have gotten to be some sort of controversial issue. And I think that's unfortunate because I think what masks are a way, they are a tool that will allow us to have a lower level of coronavirus infection with the same given level of activity. So there's a lot of discussion about how much to open up business and whether to restrict that or not. One thing I think everyone can agree upon is no matter what level of activity we're doing, if we're wearing masks, we can have a lower infection rate. So I just want to remind everyone to reiterate to wear those masks whenever you're not able to socially distance. I think that is going to be something, I think it's actually an act of economic patriotism, if you will. That's going to help us have our economy recover because we're going to be able to have more activity ongoing with a lower infection rate. So I think that's something that's important that needs to be said. And I believe that if we are all vigilant, saw a study the other day that had different models that showed the different infection rates based on different amount of mask wearing. So, and again, as I understand it, and again, I'm not a scientist or an epidemiologist, but my understanding is my mask protects you, your mask protects me. There's been lots of divisiveness on that issue, and I would ask everyone, when you see someone wearing a mask, don't think, oh, that's someone that I don't agree with because I'm not wearing a mask or whatever. I think people wearing a mask in public should be admired and respected because that person is going the extra mile to reduce the chance that they infect someone else and make that person sick and maybe have a bad outcome. So I stand here as someone in my mid-40s, no underlying health conditions that I'm aware of. So I'm not concerned for my health so much. I'm concerned for someone else who I might infect. And so I would ask everyone to consider that in all their actions is let's all think about everyone else. In my mind, I can think of my parents are in a higher risk age group. I would feel really bad if I was asymptomatic or didn't know that I was sick and I infected them and something bad happened. But I should also be concerned about not just someone I know, someone in my family. I should be concerned about those other people that I'm grocery shopping with, that I'm going and seeing at some store. I should be the better person and make sure that I'm doing a small thing, I think is a relatively small thing to wear a mask, to do what I can to protect those other people I come into contact with. So I'll leave you with that today. Just want to emphasize that. So if you can't do the 6 feet, wear a mask, please. If you're at home, if you're riding in a car by yourself or whatever, don't think you need a mask. But if you're going to be in groups of people where you can't socially distance, please wear that mask. With that, we are continuing our current operations here at the county, but I just do want to remind everyone that you can now do business in person with the county in a lot of ways. You can find more details about that on ircgov.com. We have a button right up top where you can make an appointment. If you need to get a building permit, you need to do something with your utility water bill, you've got something for public works, you can have an in-person appointment in addition to our online services, and we can help you over the phone with most of these things. Again, county libraries are also open by appointment only for computer usage, and you can contact them via phone to make those 1-hour appointments as well. And please, everyone, remember that we are doing everything we can here to ensure that the residents of Indian River County continue in a healthy and safety manner. So with that, I will turn it over to Miranda Hawker. Thank you.
So I will continue the trend today with a mask, and I appreciate Jason really going through and talking about masks, because that's an important topic that I want everyone to pay attention to. So statewide, as of 11 o'clock today, there are 70,971 cases, with 9,982 hospitalized and 2,413 deaths. Our current number of cases is 190, with 35 cases reported this week. In the last 2 weeks, we have increased by 68 cases. Our median age is now 50. So that's the midpoint of all the numbers. It's not the average of all the numbers, it's the midpoint of all the numbers. And that median age is now 50. That has gone down. This is a 55% increase in 2 weeks. For Florida residents, there are 34 people with a history of hospitalization. The age range of our cases is from 0 to 95, with 80 men and 99 women, and this is for Florida residents. We've had 11 deaths. 6 of these were in long-term care facilities. There have been 2 additional deaths since the time we last spoke in the last 2 weeks, and 95-year-old female and an 84-year-old female. In terms of race and ethnicity for Florida resident cases, which are 179, 16 of our cases are Black, 122 are white, 19 are classified as other, and 22 are unknown and under investigation. For ethnicity, 33 individuals are Hispanic and 115 are non-Hispanic. 31 are unknown, and we are researching. We have 31 cases in long-term care and staff, and that's residents and staff. The County Health Department continues to provide that public health support to our vulnerable populations in long-term care facilities. We began our community testing in Wabasso in partnership with Fire Rescue. We tested 27 people in Wabasso. We tested at TCCH in Fellsmere last week. They were very kind to step in and offer us their facility when we are expecting inclement weather, and they stepped up fairly quickly. We tested in partnership with Fire Rescue there. We tested 83, and yesterday, Operation Hope allowed us to use their facility to test 79 people in Fellsmere, and we're grateful to them. Our county health department has tested 620 people in total, with 229 this week. CDC recommends wearing a cloth face covering in public settings. If you have COVID-19, as Jason said, even if you don't have symptoms, cloth face coverings help you prevent spreading the virus to others. So what I'm doing for you is wearing a mask. What Jason's doing for me is he's wearing a mask. And that's a good example to set. So my cloth face covering protects you and yours protects me. Cloth face coverings do not replace other protective measures. CDC still recommends you stay 6 feet away from other people. Wash your hands frequently and avoid touching your eyes, nose, and mouth. You should continue to limit your risk by taking steps to reduce the number of places you go and your exposure to other people. And I want to strongly encourage residents to wear a face covering I want to encourage you to wear a face covering when you're in the public. Our total number of tests overall is 8,126 with 190 positive, which overall, since our testing began for COVID-19, is a 2% positivity rate. Our positivity rate, that's the number of positive tests in the volume of tests that we do. And right now, we look at that, it's reported on our state report each day. And as the county health department, we're looking at that each week. Well, we're looking at it every day, but we're looking at it over a week's time for trending. And so between week 19 to week 24, which is the last 5 weeks, we've seen that trend upward. We're now at 3.6% for this week. The stay-at-home order ended May 4th. So you may be saying to me, oh, Miranda, 3.6% isn't really a big deal. I mean, what's the big deal? But the big deal is we want to keep that number as low as we can so we keep our community healthier, so we keep from exposing those residents that are more at risk for severe illness. Now, in the last week, and I talked to you about how our median age had dropped to 50. In the last week, we had 6 cases in the age group 55 to 74, 9 cases in the age group of 35 to 54, 5 cases in 20 to 34, 6 cases in those 5 to 19, and 1 in those 0 to 4. Our demographics are shifting to a younger population. We had no cases in the last week in people that were over 75. Those are numbers I really want everyone to pay attention to. So COVID-19 not only affects people who are older, and the older you get, the more likely, or with serious underlying health conditions, the more likely you are to have severe implications from COVID-19. But it also affects younger people, and everyone needs to be careful and maintain those good public health practices so we can protect all of our county residents. And at this point, that's all I have. I'll turn things back over to Jason for questions. Oh, I'm sorry, Brian, I apologize.
If anybody has any questions, you can step up to this podium here and we'll be able to take them, either for Miranda or Jason.
I had a question for Miranda Hawker, that's okay?
Yes.
Can you talk more about the positivity rate? Did you say that it was 3.6%?
3.6% for this past week. Yes, and we're not, well, the current week we're in, and we're not all the way through that week. So when we look at our rate over the last 5 weeks, we've seen that rate increasing week by week. So yes, we are doing a greater volume of tests, but we are also seeing our positivity rate creep up. And that's why I really want to remind everyone to wear their masks in public, wash your hands, don't touch your eyes, nose, or mouth, maintain that social distancing. Don't carry a stick around, but maintain your social distancing of that 6 feet, because that will help protect all of us.
Okay, gotcha. And also had another question. Do you know where on the Florida Department of Health dashboard site that we can find the current number of hospitalizations in Indian River County?
So what I can tell you, the current number of hospitalizations is we have 4 people that are hospitalized, and 1 person that is in the in ICU.
Okay, but that's 4 altogether hospitalized? Okay, gotcha. Okay, thanks.
Yep.
If I could ask, the cases that you were quoting earlier, were they showing symptoms or or not showing symptoms, or do you know?
I don't really have that data broken down, but I can tell you we've had both symptomatic and asymptomatic cases.
Okay, so there's no breakdown on
I don't
the
have
new
that.
cases, how many of them were showing symptoms?
I don't have that. On average, what the CDC has advised is approximately 35% do not have symptoms, or they're asymptomatic or pre-symptomatic.
And that leads me to the criteria that you're using for testing. For example, you said you did testing in Fellsmere recently. What is the criteria that you're using to test people? I mean,
Anyone that
who gets anyone? Okay.
anyone that would like a test.
Okay, whether they're showing symptoms or not.
Correct. The hospital is still testing. That person needs to have symptoms to be tested at the hospital, but they've opened up their testing a bit as well in coordination with the DOH guidance. Thank you.
From the administration perspective? Some offices are open by appointment, and things are beginning to open up a little bit. Do you have a crystal ball in terms of how things may progress over the next few months, if things will remain pretty much the same through the summer, for example?
Yeah, my crystal ball is cloudy. A lot of times the weatherman doesn't get the weather right in 2 or 3 days, so I'd hate to try and project what's going to happen over the next couple months. Right now, we are just evaluating the data that we see. We're a little concerned that the number of cases is going up and the positivity rate's going up. Our absolute numbers aren't very high, but the trend is not positive. So we're just basically, in a holding pattern right now, and we will continue to make adjustments based on the conditions.
With cases going up, you're just taking cues from the governor and from Washington pretty much in terms of how to proceed? I'm assuming that there aren't any particular local contingency plans in place at the moment for if cases dramatically begin to get worse.
So we're all governed by the governor's orders, and we're following those. What we have been doing most recently is making decisions about county facilities and not making decisions about changes to the community restrictions. So we're not doing that at this time right now. We're just taking the governor's lead. All right, thank you. And I brought my stick just in case the questions got too tough.
Any further questions? Okay. Thank you, everybody, for joining us today. And again, a reminder for all of the most up-to-date information on county services, county facility operations, visit our website at ircgov.com and follow us on Facebook at facebook.com/ircgov. Have a great weekend, and we will send out an alert next week about a press conference. Take care.